Sam. Another great lecture to our ROE Dental Laboratory staff today. Today we talked about mounting models and evaluating bites to make sure the cases are right as we're working on them. Because as you know, if a case is the mounting is off or the bite is off, the mounting's off, and we don't catch it, the doctor doesn't catch it, it can just result in a bad case. But you mentioned that we follow Spears kind of guidelines to mounting models. So tell me about that a little bit.
Yes, absolutely, BJ. So this was a really important topic. It's one that we see every day in the laboratory. How do we know that cases are mounted correctly? One of the things I brought up today back here was Spears, steps to accurately mounting cases, and I really stressed number 2 here because a lot of times those silicone bite registration records that the doctors send us, don't fit accurately. Those bite registrations come through the embrasures, they come through on other existing dentition that's there, so we really stressed making sure that those are cut correctly, fit correctly without any bounce, and that we have occlusion on the adjacent teeth that are there. We want that bite registration to only be over the preparation sites. That would be most accurate.
So for a dentist that is providing a bite registration, you're telling me you'd suggest save some material, use less bite registration, just squirt it over the preparation.
Yeah, absolutely. We find dozens and hundreds and dozens of cases that we do. It's like the bite registrations that are given to us over the preparations are always more accurate because the doctor can visually see that the patient is closing, they're in occlusion, they know that the bite registration is accurate. If there's a bite registration that's over a single prep and then goes along half the arch, we know that there's a gap. We know that it's not accurate. So maybe trim the bite registration, chair side even. Take your scalpel afterwards and cut it away. Put it back in the patient's mouth. Have them bite. Make sure that everything is accurate.
Yeah, that's a great idea. If they trimmed it instead of us and put it back in to make sure teeth are contacting and they're satisfied, that'll make a big difference.
Absolutely. The biggest thing is the embrasures. It's like that registration material goes everywhere. Once we have a stone model, there's no flex, move, anything. It's very hard if you have a lot of material there to get it back into the correct position. Yeah.
So some doctors will pour models in their office. What are some tips for their staff to make sure that the models we receive are accurate? Because if we catch it in the lab, which we catch most things, it's just a delay in the case and time frame, and then the patient has to come back in. So what tips would you have for a staff member when they're looking at their poured models to make sure they look good?
Yeah, I mean, typically we're going to see alginate impressions poured, and some of the biggest things we see that we have to correct are drags in the alginate that gets poured, or a bubble that's captured in the alginate that gets poured, or impression, and then just taking that out and just visually looking at the occlusion. Just take a quick look at it and see anything that stands out. What stands out? Is there a bubble here? Is there a drag? What's going to affect the occlusion for us? Chair side, that you can do there at the office.
So Sam, there was a question from one of our removable team members about establishing the plane of occlusion on a maxillary mandibular full arch denture. I know you had a nice answer for that. I know it kind of comes down to the doctors providing us the information of setting that plane of occlusion.
Yeah, I mean, for sure. The question was about the plane of occlusion on a denture with a double bite rim. How do we know once that bite rim once the teeth are set, the bite rim's gone. So there's no permanent record of that. So we have to just rely that the technician set the teeth in the correct position. So we really have to know that right on the prescription if there's any information on the plane of occlusion, and just making sure that we have that accurately mounted in the correct horizon and everything. So yeah, that was a big topic of discussion. I'm glad we brought it up. You had a good answer for that too. That was good.
Great. Well, thanks, Sam, and have a great day.
Thank you. All right.
To receive a copy of this lecture, visit www.rodentallab.com/ROE Reviews.